Welcome, and thank you all for joining us today. This is Evidence of Inequities, Leveraging Air Pollution Research Advancements for Environmental Health Policy Decisions, hosted by the White House Office of Science and Technology Policy and the Health Effects Institute. A few logistical notes before we begin. All attendees are muted for the duration of this event. We'll be recording this event for archiving purposes. Closed captioning is available by clicking on the CC button at the bottom of your Zoom window. My name is Gretchen Goldman. I'm the Assistant Director for Environmental Science, Engineering, Policy, and Justice at the White House Office of Science and Technology Policy, or OSTP. This event is part of OSTP's Year of Evidence for Action Forum series. These forums are co-hosted between OSTP and leading nonprofits and academic organizations in collaboration with the White House Office of Management and Budget. The forums have allowed us to co-develop concrete strategies for mobilizing research-based evidence that can make life healthier, safer, more equitable, and more prosperous for the American public. You can learn more about OSTP's evidence forums and upcoming events on our webpage at ostp.gov. And when we think about translating evidence to policy, we have tremendous opportunity in the area of air pollution and environmental health inequities, the focus of today's forum. Air quality researchers are now pushing the bounds beyond what was previously possible in our understanding of air pollution levels and human exposure over time and space. And as new innovations emerge in ground-based monitoring and remote sensing, modeling methods, and community-driven research approaches, the scientific community has the opportunity to leverage these tools to better assess and better address inequities in air pollution exposure and associated health effects. Today, we'll hear from researchers who are actively applying air quality science and technology data and tools to environmental justice policy questions. Then we'll hear from researchers who've successfully worked with local and state officials to enact evidence-informed and community-centered environmental justice laws. We'll then be joined by federal agency and community leaders engaged in applying this science and evidence for decision-making, and we'll close with a bigger panel discussion with all of our speakers. Throughout this event, we will have audience Q&A. And as shown on the slide, you can pose questions for our speakers at any time by going to slido.com and entering the hashtag OSTP-HEI. First, before we begin, we have some opening remarks. So I'd now like to introduce the Assistant to the President and Director of the White House Office of Science and Technology Policy, Dr. Arati Prabhakar.
Thank you so much, Gretchen. And thanks to you and all of our OSTP team who put this event together. And I also want to thank our co-hosts and our colleagues at the Health Effects Institute. This has been a great partnership. And I know you're going to hear from some really interesting speakers. I just want to start by observing that we're here to talk about what is the simplest and one of the most fundamental ideas you could possibly imagine, and that is the idea that every single person deserves to be able to breathe clean air. It sounds super obvious, but it should not matter what zip code you live in. It should not matter what your gender is. It should not matter what your race is. You deserve to breathe clean air. And it seems obvious, but we all know that this has been a very long struggle to make progress on this seemingly simple topic. And it's sort of amazing to think about because apparently we've known since the ancient Romans knew about the problems that pollution can cause. This is not exactly a new insight. So we have records that date all the way back to really quite ancient times. So we've known that health effects can result from breathing pollution. And then, of course, in the middle of the last century, both here in the United States and in London, some horrific smog events that killed many people, left lots of the population with devastating health effects, really got people's attention. And with a lot of work from an environmental justice community that has built and grown over many years, we finally were able to get the Clean Air Act implemented. And that was, of course, just a major step forward. And, I think all of us that do this kind of work we always feel that we're pushing these boulders uphill, but take a minute and think about what has come out of pushing that boulder uphill a few decades ago. The estimates are that 230,000 people's lives were saved because of the Clean Air Act over a 30-year period from 1990 to 2020. 230,000 people. And that is a tremendous advance. It tells us that doing this kind of work is really worthwhile. And it's not enough yet where we are today, because what we implemented with the Clean Air Act, big step forward, but not really complete. And just a very simple example is, of course, the way that we measure pollution today is on an average basis. That's how you get, information that can steer decisions, for example, across a whole city. But inherent in the fact that you're making an average measurement is the fact that you're not getting an understanding of the exposure of fence-line communities, the people who are bearing the greatest brunt of this terrible pollution and the health effects that come with it. And what that means is that today we know that over 50,000 people in the United States die prematurely every year because of air pollution. And we know that that disproportionately affects communities who are in these fence-line regions. And that's the work that now has to get done, and the work that the environmental justice community is addressing. They're doing the work so that every community can access the bounty of nature, so that every community is protected from environmental hazards, so that every community has a say in the decisions that affect the air that they breathe and the water that they drink. And I think the good news that we're here to talk about today is the fact that now we have some really powerful new ways of tackling this hard problem. We've got some tools. And if you think about the innovations that have been made in satellites and sensors, and then the models that we're building and designing with that, we're able now to shine a much clearer light on what is going on. Just as a simple example, our ability to be able to look at air quality monitoring is 100,000 times more fine-grained than what we've been able to do in the past. And what that means is that we can see what's happening on a block-by-block basis. Now we're starting to get the technological capabilities that really can give us the hyper-local, the real-time information that we need. So those are incredibly important advances, and they don't mean anything if we don't get them across the finish line and turn them into the changes that really change outcomes for the people who are being affected still today. And so what we're now, I think, at this moment where these innovative technologies need to come together with communities and turn into really practical, scalable solutions. And I think that's really what this is all about. And I take hope from the progress in the past, because I know at the juncture that we're at now, it's actually going to be possible to build a future where fewer kids have to use inhalers to be able to breathe. And I know we can build a future where workers don't have to take as many sick days because of the exposures that they've had, and where more and more people can spend more time out in the fresh air without worrying about being hospitalized. And that's pretty basic. So that's the agenda for this community. And I just want to thank everyone for being here at the starting gate. And I want to see how we get to the end of this and really deliver results that change outcomes for people. Thanks so much for the chance to be here. And I'll turn it over back to you, Gretchen, or can I turn it over to Daniel?
Yeah, thank you, Dr. Prabhakar. I appreciate those remarks. And we'd now like to turn to Health Effects CEO Dan Greenbaum for some opening remarks.
Thank you, Gretchen, and thank you, Dr. Prabhakar. We really appreciate the opportunity to join with you in co-hosting this very important event. And you alluded to this, but it's auspicious that we are actually holding this during the week which marks the 70th anniversary of the London fog, which was really the beginning of modern air pollution control in Europe, in the UK, and ultimately in the United States. And we've made much progress, but there is a tremendous amount more to do. I'm really pleased, and we are pleased at HEI to be part of this discussion. We have made many contributions over the years to moving the ball forward, working with our partners at EPA and industry, and providing the science that supported new clean diesel rules, which dramatically improve diesels, even as we now try and transition away from diesel altogether. Using some of those technologies that Dr. Prabhakar mentioned to estimate the exposures to air pollution in 68 million Medicare recipients in the United States, which right now is part of the discussion about tightening the air pollution standards for fine particles in the United States, even as we speak. And digging deep with community organizations in the past into hotspots in environmental justice communities. But I think we all know, and this is the challenge, I think, for today, that we have a new and different set of needs. Science does not just need to describe what the problem is and what the disparities are. We have a lot of information about that. We could always use more. Scientists always like to use more. But we have a lot of information about that. And we at HEI are working in two ways to try and really turn towards work that points us towards solutions. One of those is to figure out how to best build lasting partnerships between community organizations who are closest to the problem, understand it the best, and scientists who can help document some of the issues and use that to produce policy outcomes. And the second is for us to constantly try to track progress and do science so that we know whether or not actions we're taking are reducing disparities. Just last year, we published a study of the California Goods Movement Program, which cleaned up diesel vehicles in the ports of California. And we were able, through our investigators, to document not only that the people living on the heavily exposed truck routes saw less air pollution exposure, but that they also had fewer hospitalizations as a result of that improvement in air quality. That's what we're going to need to be doing very significantly as we move forward. I'm looking forward. We have a great panel here of people who've been engaged both in the communities and in science to try and help us move forward. And out of this, I'm hoping that we can all find ways to make that next piece of increasingly challenging but doable progress for reducing disparities and improving public health. Thank you.
Great. Thank you so much, Dan. Appreciate those opening remarks. I'd now like to pass the baton to my colleague, Melanie Buser, Assistant Director for Environmental Health at OSTP.
Thank you, Dr. Goldman. Our first presentation is from Dr. Paloma Beamer. Dr. Beamer is a professor in the Community, Environment, and Policy Department within the College of Public Health at the University of Arizona. She is an environmental engineer by training and earned her BS from the University of California, Berkeley, and her MS and PhD from Stanford University. Her research focuses on understanding how individuals are exposed to environmental contaminants and the health risks of these exposures, with a special focus on vulnerable populations, including children, low-wage immigrant workers, Native Americans, and those in the US-Mexico border region. The ultimate goal of her work is to develop more effective interventions and policies for prevention of avoidable cases of certain diseases, such as asthma. Over to you, Dr. Beamer.
Great, thank you. Are you able to see my slides now? Great.
Yes.
So good afternoon. It's a pleasure to be here with you all today, and I'm going to share with you a few thoughts based on my work here with communities across Southern Arizona and Northern Mexico. My goal here is to provoke thoughts of how we can work towards improving air quality and community health and ultimately promoting environmental justice. And I apologize. Here we go. One opportunity for improving air quality is to work with small businesses, and promotoras, as we call them here, or community health workers from a local nonprofit environmental justice organization known as SERI, noticed while doing household visits for a children's asthma project, this really strong smell of chemicals in the neighborhoods they were working in. And they started mapping the small businesses and conducted a hazard risk analysis based on chemical usage at those small businesses that you can see here on this map. They then went on to go on at SERI to develop a comprehensive multimedia pollution prevention program for small businesses that was conducted by the promotoras themselves. During that work, They confirmed that many small businesses were using hazardous solvents, and they were not aware of many of the hazards due to several barriers, including language and access to online resources. In a separate spatial analysis that I conducted using data from a 40-year-old birth cohort we have here in Tucson, I identified spatial clusters that are indicated on the map, that I overlaid on the map with those black dots. And these are regions where children had higher rates of wheezing illnesses than would be expected by chance. Even prior to COVID, occupational disease was the 8th leading cause of death in the US. And as the remarks we just heard, everybody should have the right to go to a safe job. What if we could focus on reducing the workers' exposures, which also could then help us assist with pollution prevention in communities? So as a community partnership between SERI, our local community health center, El Rio, and the university, we applied the socioecological model of health to examine how we could reduce the exposures of workers in small businesses and ultimately address community exposures. While there are federal and state regulations to address this, the sheer number of small businesses across the United States outweighs the capacity of those agencies to be able to work with each one. Thus, there's a number of physical, economic, and social barriers that need to be overcome. As a partnership, we propose to add training in industrial hygiene and the hierarchy of controls to SERI's small business program. And we developed a promotora intervention that we're currently testing in a formal clinical trial funded by NIH to determine if we can reduce those exposures. I'm going to completely switch gears now, but another area where I think we could begin thinking about reducing the impact of environmental exposures in some of these communities is to recognize the importance of the air transport pathway in our indoor exposures to outdoor soil contamination. Given that we spend over 90% of our times indoors, it is important to understand how these exposures occur. We developed and validated a model to look at these relative contributions, and we demonstrated that depending upon the time of year or the region of the country, that 60 to 90% of non-volatile contaminants in house dust, such as lead or pesticides that are coming from outdoor sources, likely enter via the air. We and others have also demonstrated multiple times that these soil contaminants are concentrated in smaller size fractions. In our current study funded by EPA, where we are performing hand rinses on children ages 6 months to 6 years, we're seeing that at least 89% of the particles on their hands are less than 60 microns in diameter. Particles in this size range are not only inhalable, they are also easily resuspended in the air. Yet our current soil sampling guidelines recommend that soil be sieved to 150 microns prior to being analyzed. And while yes, as our data shows that the majority of particles on kids' hands are smaller than 150 microns, as 60 is smaller than 150, we have also demonstrated that the concentration of most soil contaminants is significantly higher in particles in that less than 60 micron range than those in the 60 to 150 micron range. Thus, by using larger sieve size when we look at soil contamination, we are underestimating potential exposures via inhalation and dust ingestion. Now, if you think about like here in Arizona, but across the United States, we have over 400,000 abandoned mines and many active mines in the US. This could have important implications in those communities. But it would also be important to assess in urban environments where the importance of historical vehicle emissions from leaded gasoline still contribute substantially to soil contamination, as demonstrated in this study conducted by colleagues at UC Irvine. We have shown that 90% of the agricultural pesticides we measured in house dust and farm worker homes also likely entered via the air versus tracking on clothes and shoes. And due to climate change, and we need to start considering building structure adaptations with this increasing frequency of dust storms, like this picture of a haboob over Phoenix a few years ago. Now I want to focus our attention on some lessons that we are learning from our work on the US-Mexico border. Tucson, where I am, is about 100 kilometers north of the sister cities of Ambos Nogales that straddles the border. Nogales, Sonora has a very high population density in comparison to the Arizona cities that you can see on this map. This port of entry has some of the highest truck and train traffic, and there are several maquiladora parks. We also anticipate to have increased truck and train traffic as there's more deep water ports going into Sonora. However, when we did an asthma prevalence survey among middle schoolers, we found that children of Mexican descent in Tucson actually had almost 5 times higher rates of asthma than the children living in Nogales, Sonora. In a separate study, we demonstrated that a microbial diversity collected from assessed in house dust that we collected in homes in Nogales, Sonora is much greater and significantly different than that in the homes in Tucson. This has led to a new binational birth cohort study to look at this longitudinally, funded by a program project grant at NIH. When you think about it, with only 1 in 7 cells in our body being human, perhaps one of the things we need for resilience in these communities is to begin relearning the lessons of our ancestors on maintaining balance and harmony with the natural world. Lastly, I want to talk about the importance of holistically working with the communities to achieve their environmental justice goals. Along with a group of rising scholars of color and other researchers that have worked with marginalized communities for many years, we laid forth a new framework for conducting exposure studies with communities that is based on the 19 principles of environmental justice established at that 1991 First National People of Color Environmental Leadership Summit. Even though it's been more than 30 years, those principles still ring true today in the communities we work with. This framework counters the traditional linear approach to exposure studies as demonstrated by, on the outside of the ring, with a circular model that we have on the inside of the ring that includes building sustainability and capacity in communities and really working towards diversifying the research leadership. And with that, I'll stop. Thank you for your time today.
Thank you so much, Dr. Beamer. I would now like to introduce our second presenter, Dr. Rachel Morello-Frosch. Dr. Morello-Frosch is a professor in the Department of Environmental Science, Policy, and Management in the School of Public Health at UC Berkeley. For over 20 years, her research has examined social determinants of environmental health among diverse communities with a focus on inequality, psychosocial stress, and how these factors interact with environmental chemical exposures to produce health inequalities. In collaboration with communities and scientists, Dr. Morello-Frosch has also developed science policy tools for assessing the cumulative impacts of chemical and non-chemical stressors to improve regulatory decision-making and advance environmental justice. Among other honors, she was inducted into the National Academy of Medicine last month. Over to you, Dr. Morello-Frosch.
Thank you so much. Sorry, struggling here. Okay, here we go. Thank you for having me, and I'm looking forward to this conversation with my colleagues. Today, I want to talk a little bit about, to add on to the great presentation by Dr. Beamer, is to really think about and provide some examples of how EJ advocates have forced scientists like myself to really think about fundamental drivers of environmental inequities, and also a little bit thinking about solutions-based and anticipatory EJ research that can really inform policymaking and advance environmental justice. So the example I wanted to talk about today is this issue related to redlining and racial residential segregation, which numerous studies have shown are related to the disproportionate exposures and impacts of poor air quality on marginalized communities, in particular communities of color. And you can see in this map here, levels of racial residential segregation across metropolitan areas in the United States, and the red areas are places that are considered hyper-segregated, where about 60% of residents in those metro areas would have to move from one census tract to another in order to achieve an even distribution. And the drivers of these current patterns of racial residential segregation are rooted in legacies of discrimination, including redlining, which was undertaken during the 1930s by the Homeowner Loan Corporation. And an example of current work to look at the impacts of these legacies of discrimination, in particular redlining and air pollution. We've been fortunate in the digitization of these redlining maps, where we can actually look at the relationships between historical redlining and current levels of air pollution and disparities in exposures. So in a project that we undertook here at Berkeley, you can see redlining maps of different cities in the United States, Philadelphia, Chicago, Los Angeles, and Detroit. And then here you can see practically a dose-response relationship in the population weighted levels of nitrogen dioxide, with the lowest graded neighborhoods in metro areas having the highest levels. And then here on the right, you can see population weighted mean annual interurban levels of NO2 and PM 2.5 by, again, redlining grades. So A being the best grade and D being the worst. And you can see this dose response relationship in nitrogen dioxide levels and also in PM 2.5 levels. And then each line here represents a different racial or ethnic group. And you can see here that in general, across grades, you see persistent racial disparities with African Americans and Latinos tending to have higher burdens across grades, with the biggest disparities in the worst grades. So this has implications. These legacies of discrimination have implications for the disproportionate impacts of air quality among certain marginalized groups, in particular, again, communities of color. Several studies have documented this in terms of fetal growth outcomes. And one example is a study that we did a long time ago in California, where we sought to examine the birth weight impacts of different forms of PM, PM10, PM 2.5, and of course PM. And I want to draw your attention to the middle here, where we saw that on average decrements of term birth weight were anywhere from about 10 to over 20 grams in term birth weights. And you can see that the effects are most dramatic for the red group here, which is women who self-identify as African American. And similar studies in other parts of the country have documented similar disparities in effects of PM on these fetal growth outcomes. So what are our opportunities to do what was described as kind of solutions-based science? And so one strategy that is increasingly being done, I think, in the air pollution world is to leverage what we call natural experiments, where we have events where, for example, sources of ambient air pollution are removed or reduced. And we want to see whether or not we can see a signal in terms of health benefits in communities living nearby. And so one example is a study that we undertook looking at 8 oil and coal power plant retirements in California over a period of 10 years. And we wanted to see whether or not we could see a signal in terms of impacts on preterm birth weights in communities nearby these plants that retired. And what we saw here is, if you look at overall effects, an average decrement of about preterm births of about 2% at different buffer distances. And then the other thing I want to draw your attention to is that we saw some of the most impactful effects in terms of decrements in preterm birth rates among Asian and Black mothers who were living near these sites. And so I think this is a nice example where we can look at the overall health benefits of interventions to reduce air pollution, but then also assess some of the benefits for equity. Another example is work where we're trying to leverage more granular measurements of air pollution. It was, previously stated that, the average in some ways erases the extremes, and this is what fence line communities care about the most, particularly in areas that have disproportionately high levels of air contaminants. And so we looked at effects of we wanted to look at exposures to nitrogen dioxide, black carbon, and ultrafine particles. In Oakland, in West Oakland, which is an area that is has very concentrated at high levels of air pollutants, in part due to freeways as well as due to the Port of Oakland. And we leveraged data from Google Street View cars that was taking repeated samples for NO2, black carbon, and ultrafine particles every 30 meters in our study area. And we were able to link these exposure data to electronic health records from a healthcare provider that serves this population, a significant proportion of them, to identify cases of preeclampsia. And what we sought to do was, what would happen if we had a hypothetical intervention that reduced levels of these contaminants to the 25th percentile from the exposures that we were observing in these different neighborhoods. And what we saw was quite stunning, actually, because what we saw was that the differences in preeclampsia levels per 100 women that were associated with this hypothetical reduction was significant in terms of for nitrogen dioxide, and regardless of whether we measured it within 30 meters of the residence or 120 meters. We also saw significant benefits for hypothetical reductions of black carbon and a little bit less so for ultrafines. And then when we stratify again by maternal race and ethnicity, I want to draw your attention to the effects for Black mothers, where in terms of equity implications, we saw pretty significant and dramatic effects in terms of reductions in preterm birth, preeclampsia among this group, which is at very high risk of this adverse maternal health outcome. So what are the implications of studies like this for addressing cumulative impacts? And as what was previously stated is that, this scientific work is really evolving rapidly. We're always trying to make it better, but the communities that we collaborate with don't want to wait until we figure everything out. And so many of us have collaborated on the development of mapping tools that integrate place level measures of both environmental and social stressors so that we can highlight communities of potential regulatory concern and target strategies that advance EJ goals. And I think there's opportunities for scientists to share and contribute to enhance these decision-making tools. And examples of those that I have had the opportunity to collaborate on is CalEnviroScreen, which has integrated both environmental and social stressors to identify disadvantaged communities for investments for climate investment funds to reduce emissions and also promote climate mitigation strategies. And then more recently, the release of the Council on Environmental Quality's Climate Equity and Economic Justice Screening Tool, which is going to be leveraged for implementation of the Justice 40 initiative. And I will stop there. Thank you very much.
Thank you very much, Dr. Morello-Frosch. I would now like to pass this back to Gretchen.
Thanks so much, Melanie. I'd now like to take us into the next segment of our agenda for the forum today. Next, we're going to hear from two researchers who have been working to tackle environmental justice issues for many years and recently helped advance a significant law that employs research and analysis for environmental justice policy decisions in innovative ways. Dr. Nicky Sheats is the director of the Center for the Urban Environment at the John S. Watson Institute for Urban Policy and Research at Kean University. He's defined the primary mission of the center as providing support for the environmental justice community on both the state and national level. Among many issues, Dr. Sheats has worked on particulate matter, air pollution, climate change, cumulative impacts, and on developing legal strategies and increasing the capacity of the environmental justice community to address these and other issues. Dr. Sheats holds an undergraduate degree in economics from Princeton University, a master's in public policy, a law degree, and a doctorate in earth and planetary sciences from Harvard University. He currently serves on the White House Environmental Justice Advisory Council. Dr. Baptista is an associate professor and New Jersey Environmental Justice Alliance trustee. Dr. Baptista's recent research focuses on efforts to advance national, state, and local environmental justice policies, and her professional practice is based primarily in community-engaged scholarship and critical participatory action research. Welcome, Dr. Sheats and Dr. Baptista. So to get us started, I wanted to focus on the New Jersey environmental justice law that you both have been engaged on. In 2020, the state of New Jersey passed a landmark environmental justice law that, importantly, links environmental injustice directly with policy outcomes for communities. The law defines overburdened communities and prevents additional permitting for industrial facilities near these communities. And this policy provision required thoughtful analysis about what constituted an overburdened community. And so I wanted to hear how you both approached this research challenge and ultimately got policymakers' support for inclusion of this analytical frame in this unprecedented law.
I'm going to let Dr. Baptista go first.
Thanks, Nicky. Thanks, Gretchen. I think one of the things we did, Nicky and I, with our colleagues, really in the environmental justice organizations, in New Jersey that really formed the coalition, the backbone to advance this policy. We really worked with researchers that we trusted, folks who are on this call today, like Dr. Morello-Frosch and others who we know were really knowledgeable about how to set out methodologies for determining cumulative impacts. We also used our own research and many years of looking at how different states and policies defined environmental justice communities. I know the law has defined it as overburdened communities, but really it's closer to what we would consider an environmental justice community, because it uses demographic, sociodemographic data to look at those communities. We did our own mapping with community organizations, EJ groups on the ground, to identify communities and try to set some really what are normative thresholds around what we consider an EJ community in New Jersey specific communities. And so we relied on a diverse, I think, source of data, both community bottom-up community input on what folks considered an EJ or overburdened community, and also looking at the latest data and science on methodologies for making those determinations and thresholds. I don't know, Nikki, I'm sure you have more to add there.
Yeah, but that was good. I want to point out one thing, that the law prevents additional citing under certain circumstances, right? So what Anna was talking about, it defines an overburdened community. As Anna said, it really should be an EJ community, but we were so happy that this was going on, we didn't correct it at the time, causing some confusion now. And then does an EJ analysis that involves environmental indicators, and under certain circumstances, then if you're asking for a new permit, if facility's asking for a new permit, it won't get the permit if it makes stressors higher. Let me concentrate on the part you say, how did you convince policymakers? It was a long haul. We started working on this way back to, and we did some research on this way back in 2007 is the first time that we could identify that we actually started working on this as an EJ community in New Jersey. And I got to say, I love scientists, we're scientists, right? Or at least I'm trained as a scientist, but they were a major obstacle to this, because when we first started going around and we're actually looking for data, and scientists or scientific colleagues would say, well, we don't know how to do this. We don't have the studies. And the policymakers too, on the state and federal level. And we argued to them. We said, well, look, especially those people in the Department of Environmental Protection in New Jersey, we said, you are tasked with protecting the public health. And we did convince them that the way we look at pollution now, individual standards, is not taking into account any kind of cumulative effect, right? You're not taking into account this kind of deadly mixture, what we thought was a deadly mixture. And they're certainly having impacts, even though you're not taking that into account. And you can, but you shouldn't just sit here and not do anything. You're not doing your job. You need to move on this before Rachel was saying, communities need you to move on this before you get scientific certainty that will probably come when we've all passed away, or may never come. And so that, that kind of moved the question. I often say we in the EJ community have done a good job of moving the issues, EJ issues from the margins to the mainstream. But we kept saying, well, you have to do more than research it. You have to really move on these issues. And I think finally, and communities kept coming to them, right? Kept coming to government saying, you can't keep putting all this stuff in our community. There's no law that says you have to put everything in our community, which is kind of how things were going, and you need to do something. So I think that pressure and those arguments over the years finally had an impact. And we also pointed out that, not doing anything was actually, in a way, by default, making a scientific decision. When you don't do anything, you're saying that these things are not interacting. So for all practical purposes, you've made a scientific decision. And again, that goes against what your job description is and what we all want to do. It goes beyond job description. We all want to improve health. And I think over the years, and we kept at it, we're nothing if not persistent, the argument finally start taking hold, and people start saying, yeah, we need to act.
Great. Well, thank you for sharing that. I really appreciate the additional context on how you work closely with communities and also got scientists to go along and be helpful and do this in a way that is effective in terms of policy decisions. And so I'm curious in thinking about next steps on that as we continue to develop tools and as we discussed earlier, as scientists have more and more tools for developing greater certainty at smaller scales over time and space, greater granularity in measurements and monitoring and modeling efforts. Where do you see as the biggest opportunities to think more about this, especially when it comes to being able to better assess and address cumulative impacts as we've been thinking about, where do we see the sort of opportunities to expand on this work and build off of the success that you've had?
Well, I think the opportunities are all over the country. I mean, right now, so I think hopefully, and you said this, Gretchen, in your opening, I think you said you're having a series of conversations about action. I think now, as I said before, we've moved it towards a bias, I hope, for action. We only have, that I know of, the one law in the country that says you should turn down permits under certain circumstances based on environmental justice and cumulative impacts. So the opportunities out there everywhere else, still in New Jersey, but everywhere else, on the federal level, on the state levels for all these other states. Even we're working with some folks in New Mexico that even see this opportunity on the city and county level. So now finally, I think scientists, probably most of the scientists listening here, who really do have a bias for action, they want to see their work turned into saving lives directly. Now's a chance. Now's the opportunity.
Yeah, and I'll echo Nicky's sentiment. We at the Tishman Center, where I do a lot of my research, we looked at and have been talking to actively several state legislators. I say there's a big opportunity in states and a big interest in states because EJ activists see a window of opportunity to push forward on a more aggressive kind of, policy that can tackle permitting, in particular, permitting enforcement, and in some cases investments as well. But we have a bill in the New York legislature. There are several, there's over a dozen states either promulgating or proposing bills similar to New Jersey's, but not exactly like New Jersey's, but that try to definitively weigh in on permitting decisions using some form of cumulative impact assessment. And that's a really important step forward, that there's a diversity of methods that different states are proposing to use. And I think that's important because states are different. They have different sociodemographics. They have different threats and environmental conditions and stressors. They have varying qualities of data. So the type of data and the type of stressors that are most important to different parts of the country come into effect. So I think states are fertile ground for experimentation and innovation, policy innovation, particularly also because EJ organizations and activists have been wanting to advance more, more aggressive policies, and they may have greater access to legislators and legislative change at their state level than they might, find at the federal level. Although, there's definitely been interest at the federal level as well, as Nicky mentioned.
Great. Well, that's so great to hear about the progress at the state level, and that being a rich opportunity to really build on the progress in New Jersey. So as a final question before we move to another segment, I wanted to switch gears and talk about a different policy recommendation from the New Jersey environmental justice community that also employs innovative approaches to addressing environmental justice concerns. The policy recommendation would mandate that power plants whose emissions detrimentally impact environmental justice communities be required to reduce those emissions. Can you tell me more about the role of research and analysis in this policy recommendation and the significance that it would have for addressing communities' environmental justice concerns?
Well, both Anna and I are working on this. We've been working on it for a number of years. Finally, again, maybe it has not been enacted anywhere yet, but at least people are not just dismissing it and actually starting to adopt the thinking. And although the concept is fairly simple, and let me give more context. Since there is some will to address climate change. Maybe not enough, but there is some will to address climate change. There's some policies in several parts of the country. We want to use climate change mitigation policy not only to fight climate change, but at the same time also to address the disproportionate pollution loads that you often find in EJ communities, to address cumulative impacts. And for EJ communities that as laid out, the first speaker laid out very nicely, and Rachel followed up, that are suffering really disproportionate harm from air pollution, but for all communities, right? This is an opportunity to use climate change policy to save lives right away. And certainly in our communities of color, low-income communities, we need it the most. And it's an opportunity that if we don't integrate this into climate change policy now, we may not get a chance to do it later. So it's an opportunity that may pass us by. And even though the concept is simple, identify those power plants whose emissions are detrimentally impacting EJ communities. And I should add that what we're really after here are the coal pollutants, right? That are emitted along with the carbon dioxide, particulate matter, NOx, SO2, that have locally detrimental health impacts now. We really, and to contribute to that disproportionate pollution load, we really want to make sure those are reduced along with carbon dioxide. So although the concept is maybe fairly simple, identify those plants whose emissions are detrimentally impacting EJ communities and force them to reduce emissions under whatever climate change policy they're under, no matter what type of policy it is, whether it's a market-based system or regulatory system. We understand there are some gaps in the research. How much should you reduce? How do you define EJ community? How do you take into account leakage, that if you reduce here or force plants here to run less to reduce, what happens in other areas? So there are, there are research questions that we really do need help on. And Anna can expand. The Tishman Center is really doing this, taking the lead in New Jersey on identifying which plants should be forced to reduce.
Yes, we'll have a paper soon, right after the lead author, Nicky, gets through with it. But we are looking at 3 states and looking at the power sector. And yeah, some of the things we're grappling with is our leakage. How do you model emissions? What are the threshold reductions that you look for in these plants? So there's a lot of areas to research still to figure out how to do it. But I'll just say New Jersey did just pass a power sector rule last year. And it was a model in a way that we could take to say, okay, if we were to propose this rule, actually targeting EJ and doing mandatory emissions reductions, there's an opening there to actually deliver this idea through these power sector rules that states are implementing.
All right, great. Well, great to get the preview for the paper as well. And we've had one question come through on the Slido that I wanted to ask, which is about the New Jersey environmental justice law and whether it would cut down on the number of facilities emitting toxic pollutants, amount of pollution, or just restrict where they can be cited.
You want to take that one on?
Sorry, I was yelling at my kids in the background. The rule, I guess, so the question is it restricted for new permits in overburdened block groups? where there's a determination that it's contributing or causing adverse disproportionate impacts. And there's a whole methodology for a relative analysis of impacts in comparison to non-overburdened block groups. The mandate is you shall deny the permit. So it's an outright denial unless there's a compelling public interest, and there's a compelling public interest clause. But we believe that the way it was drafted is it excludes economic. It has to be a pretty narrow. There's a pretty narrow clause there for compelling public interest. For renewals of permits, most permits have renewal cycles, 3 to 5 year renewal cycles for renewals of industries in overburdened block groups. The mandate is to condition if there's found to be a contribution or cause to detrimental impacts. So there's an opportunity and a new authority basically to the state to open up permits for consideration of new conditions that hopefully will ratchet down or mitigate on-site emissions of those facilities.
Got it. Well, thank you so much. Really appreciate your time on this segment. I'm great to hear about the success you've had in New Jersey in thinking about the analysis with the community input, with what's needed from a policy perspective. And so we look forward to seeing more of what comes out of New Jersey and across the country on these issues. I'm now going to pass it back to my colleague Melanie to take us to the next segment of the forum.
Thank you, Gretchen. I'd now like to transition to a conversation with two people that work at the intersection of air pollution and environmental justice, science and evidence, and its policy applications. First, we have Marianne Engelman-Lado, Acting Principal Deputy Assistant Administrator for the Office of Environmental Justice and External Civil Rights at the U.S. Environmental Protection Agency. Ms. Engelman-Lado joined the EPA as Deputy General Counsel of Environmental Initiatives, where she focuses on implementing the administration's commitment to equity, environmental justice, and civil rights enforcement, and carrying out the agency's mission to protect public health and the environment. She is currently serving as the Acting Principal Deputy Assistant Administrator of the newly formed Office of Environmental Justice and External Civil Rights at the EPA. She holds a BA in government from Cornell University, a JD from the University of California at Berkeley, and an MA in politics from Princeton University. I'd also like to welcome Dr. Kristi Pullen Fedinick, who is the Executive Director for the Center for Earth, Energy, and Democracy. Dr. Pullen Fedinick brings over 25 years of multidisciplinary research experience to her work. She's worked for nearly 15 years at the intersection of science and public policy to advance data-driven, health-protective, community-oriented solutions. Dr. Pullen Fedinick's work has focused on affecting positive change at the local and national levels, where she has used scientific tools to advance protections for people and communities that are disproportionately impacted by environmental degradation. Dr. Pullen Fedinick received her BS in Biochemistry and Molecular Biology from the University of Maryland, Baltimore County, and her PhD in Molecular and Cell Biology from the University of California, Berkeley. She was a Robert Wood Johnson Foundation Health and Society Scholar at the Harvard T.H. Chan School of Public Health. Thank you both for joining me today. My first question is for Ms. Engelman-Lado. EPA recently formed the Office of Environmental Justice and External Civil Rights, for which you are the acting director. What opportunities do you see for this newly formed office to use air quality research to better inform environmental justice policies and actions to meet its mission?
Well, thanks so much. I'm so excited to be here. As you know, from day one, the president and Administrator Regan have made it clear that the goals of protecting public health, addressing the climate crisis, and promoting environmental justice are inextricably linked. They are inseparable. So our mission is to protect the health and environment of all people in the United States, which means targeting grants and other activities to communities that have for too long been underserved and environmentally overburdened and are most vulnerable to the effects of climate change, among other things. This is why we're so excited that the administrator launched our new Office of Environmental Justice and External Civil Rights, for the first time elevating the issues of equity, environmental justice, and civil rights to the level of a program office. Just to give a little bit of background, the new office provides the structure, the scaffolding to integrate environmental justice into EPA's programs and activities, and to work with all the programs, the Office of Air and Radiation, Office of Water, and others, to reach not only goals to reduce pollution levels overall, which is the traditional way of looking at it, but more specifically to address disparities and ensure that we're providing that equal access to clean water, clean air, and land that is safe for its intended uses, as was discussed earlier. We've baked these goals of advancing environmental justice and civil rights into our strategic plan and our equity action plan, which included a commitment to integrating community science into EPA's research and program implementation. We committed to funding community science grants, expanding available data and capacity for community environmental monitoring, and other concrete steps to advance community science in order to provide data that may inform policy. It's critical for scientists to understand what specifically is needed and how data can be used by communities or in regulatory and decision contexts. For example, some of my background in civil rights. In my experience before coming to EPA, I worked with communities that felt that researchers often helicoptered in, studied their experience, published, and then left. We're committed to community engaged research that, as Nicky was saying, has a bias for action. Too many communities, and especially low-income communities and communities of color, have just suffered for too long from high levels of air pollution and the devastating effects of health impacts from breathing unhealthy air. So we've set up this new office in a really historic time. We're poised to make unprecedented investments in air quality monitoring, and at the same time have new resources from the American Rescue Plan funding and Inflation Reduction Act to make major strides in improving air quality and to incorporate environmental justice considerations into every aspect of this work. We haven't invested in environmental protection, much less environmental justice at this level. I want to mention that the strategic plan also makes a commitment to track, and first of all, to build indicators and then to track those indicators of disparities, which is another piece of this puzzle. We are committed to developing and then tracking more than 10 disparities indicators, which will provide feedback and inform our policy going forward. And we hope shape awareness in the larger community, again, not only about that sort of more universal level of emissions, but how communities are experiencing pollution. At the foundation of environmental justice, whether in policy or in research, is meaningful community engagement. And we must listen to communities' needs and concerns and work in equitable partnership with underserved communities. It's inspiring today to hear from pioneers in community engaged research like Rachel. We appreciate that research leadership that's bridging the needs of underserved communities, atmospheric sciences, and health science, and have to tackle these long-standing disparities if we want to achieve EPA's mission. I want to provide just one example before closing. From my experience before coming to EPA, over many years, I had the opportunity to work with Steve Wing at UNC Chapel Hill, among other researchers. I represented community groups in my prior life in Eastern North Carolina who raised concerns about the impacts of concentrated animal feeding operations, or CAFOs, on their health and welfare, and particularly the hog and poultry operations that were concentrated nearby. Dr. Wing, an epidemiologist who unfortunately passed away a few years ago, charted new ground, including with an NIH grant, working with local communities on analysis of the impacts of CAFOs on the incidence of asthma and other outcomes. And he analyzed whether there was a relationship between race and national origin and living in proximity to these facilities. He also wrote about his relationship with communities and the kind of work he was pioneering. The affected communities were then able to base their advocacy and policy activities, including the civil rights claims that I worked on, among other things, on peer-reviewed literature, which was grounded in the community-based science. This relationship, I think, has a lot to tell to us, a lot of lessons learned for the future of what kind of community-driven science we can explore. At the new office, we now house an environmental and climate justice grant program and other activities, but we also are focused on strategically supporting our EPA colleagues in air enforcement and research, as well as our partners in states and cities and planning departments at universities, at ports, to better use data and engage with the organizations producing it to evolve their thinking and decisions to promote a healthy, thriving, and just society for all.
Thank you so much. It's really exciting to hear about how EPA is transitioning to incorporate those EJ considerations and civil rights considerations into the infrastructure of all of the important work you do. So thank you for sharing. I'd now like to ask Dr. Pullen Fedinick a question. Throughout your career, you've made a point of working with communities and partners who are on the front line of these issues. What have you learned about the importance and mutual benefits of working with communities on research to inform environmental justice decisions?
Yeah, thank you so much for this question. I'm really happy to be here and to be part of this panel. And I have this question right now because I feel like there have been so many examples already given of the importance and the benefits associated with working with communities. And, I found this in my own experience, but even just, in some ways, I'm a lumper, or grouper by design. And so grouping together and thinking about some of the things that we've already heard today, the two areas that really come up for me are policy informing the science and science informing the policy, right? So when we think about policy informing the science, we've heard this multiple times, the questions we ask, the decision context is so critical. What are the solutions that communities are looking for and would like to see? What are the policy levers, if they exist and if they don't, but what could be created to move the needle on these issues? And then what are the gaps that need to be filled to inform these policy areas? And so, even the story or the case study kind of example that Marianne just gave of the CAFO work in North Carolina, it's really critical to make sure that we're asking and answering questions that are relevant to the policies that will help create the change that communities most want to see. And so I think that's a really critical thing that I've learned that helps the science and helps the policy. And then also thinking about science informing the policy, typically we tend to think about it in terms of, identifying populations most impacted, which is critical work. But some of the ways that I also think about this is, our scientific training is also really critical in policy development. So understanding the ways that uncertainty work and understanding and defining best available science, which is often used in scientific contexts, but really helping to shape and inform and lead the direction on ways that we can utilize and integrate tools that are most protective of the populations most in need. And then, also thinking about how we leverage and define what science and expertise is. And so I think that Dr. Beamer mentioned this in her talk as well. But, we often tend to, think about, scientists as having specific characteristics. But I think about my 5-year-old as being a scientist. He's asking questions. He's using methods to answer those questions. And I tell him every day he's a scientist too. And so, I think that, we really need to open up the ways that we think about the work that we do. And ultimately, when we think about research, right, one could break it up into 2 sections, re and search, which could mean finding again. Communities already know the problems that they are facing, and they often know the solution sets that will get us there too. And so, doing our best to utilize our training, our understanding of the barriers that exist within traditional, particularly academic science, to remove those barriers, especially in the policy language, to ensure that we can create the kind of rapid change that communities need to see.
Thanks for that, Kristi. I really like that breaking down of research. I think that's important in this context. And as you said, the communities do already know what they're dealing with. And so just taking that in and using that to better define where we're going with these projects is really important. And so I just, one final question for you both. You both are working at this unique intersection of science and community engagement and policy decisions. And so I'm just interested to hear if you have any, thoughts on how we can better bridge these different communities, and to make these evidence-based policy decisions that really tackle environmental injustices, and how we can harmonize the efforts to improve the community outcomes.
Marianne, do you want to go first?
Okay. Either way, I'm sort of going to echo something you just said. I really think that the increase in focus on EJ issues among scientific research is beneficial and can be applied best if researchers better understand the key policy issues, the key issues that are coming from communities, and the legal frameworks that can help to improve health and promote justice. Knowing where there are opportunities or those legal frameworks need to change but knowing where there are opportunities or there already is a level of authority or discretion for using this research in a way that advances the issue. Looking ahead with the funding from the American Rescue Plan and bipartisan infrastructure law and new Inflation Reduction Act, we're making investments that will better benefit underserved communities. And with new atmospheric science and health research, we'll be surrounded by a richness of data that's hard to imagine right now, and it's going to grow deeper and more complex. So that's a positive. So much of what we push for in the integration of EJ into government decision-making has to be based, even with all that opportunity, has to be based on transparency and engagement. And I think about a meeting I went to a few years ago that Nicky was instrumental in putting together, bringing together researchers and communities and really trying to talk about what's important, what are the principles for working together, and transparency, not hiding the ball, sharing your data, sharing what you're doing was one of those principles that people talked about, and engagement, meaningful engagement. What does that mean? It doesn't just mean coming and talking at people. It means engaging with people, with impacted communities, and to understand the realities that they face. And that, as Dr. Pullen Fedinick said, making sure that the resulting decisions about research will be responsive to the needs. So we're at this exciting moment with more and more data coming online and the opportunities, as Dr. Morello-Frosch said, to represent the data in accessible ways through mapping tools and others. One of the biggest barriers to transparency and truly action-oriented research has been the gaps in data at the granular or community level. And without that data, it can be much harder to demonstrate and reflect the realities in communities and then shape policies that respond to them. We're seeing a sea change right before our eyes with environmental monitoring resources and the readiness to invest in new and creative solutions, in part through the IRA, Inflation Reduction Act. Several advances that have been touched on already are increases in low-cost sensors, which can be placed in more locations, advances in mobile measurement, which I know we're using, and fence line methods that can be used to explore information, analytic methods that can be used with a high time resolution measurement. But there are all these advances, but I just want to add a note of caution, reflecting something Dan said in his opening comments. From a community perspective, low-income communities and communities of color and other overburdened communities are often concerned that they've been providing that data, and there's been a lot of research already that can lead to action. At the NEJAC, the National Environmental Justice Advisory Council this week, for example, we heard testimony that a number of peer-reviewed research articles have been published already, documenting high levels of environmental exposure and adverse health outcomes in Manchester, Texas. But the research didn't translate into action. It just, that's the perspective that people have. You're coming, you're studying us. There was a piece of paper with all these different, names of studies, but how does it then translate into action? So like if we focus too much on here are the gaps, let's make sure we recognize you can research, but there has to be that connection. So like many other environmentally overburdened communities, residents said that their situation was already well documented, but where's the connection to action? So we're ready and excited to lift up the realities to help the entire environmental and public health protection endeavor in this country go to those places where the data shows they're most in need of protection, both to study, but only if that studying is, or when that studying is going to lead or have, as Nicky said, a bias for action.
Yeah, it's hard to follow that. In some ways, I should have had my aluminum hat on, because I feel like Marianne took a lot of the ideas that were, in my mind as well. But I absolutely think that, we do need to better educate, researchers in particular, those that are especially based in, in academic institutions or other places as well, on, what it actually takes to, create regulations, to, implement specific policies, like to know what decision context actually means at different levels of of government. And so, there can be a lot of different regional or geographic variations in the ways that policies are set up, the different kinds of information needs, et cetera. And so, really being able to ensure that people know, if you want to be able to affect these changes, how you can best engage in these processes to be able to utilize the tools that you have in order to ask and answer those questions. And then, I also think that, really trying to, in the air, if you want to affect change in the area in which you are residing or existing, finding communities that are in need of your help and asking them what they need. And if you have the tools that can help them, and if you don't, then helping to identify the folks that do. Because, again, I think Marianne also mentioned this earlier as well, the history of parachuting in and asking questions that we think are relevant or that funders think are relevant. Those aren't necessarily the questions that need to be asked and answered. And so, really making yourself available, doing landscape or needs assessments to identify how you can use your specific tools to answer those questions. And, all disciplines are welcomed. You don't have to be, necessarily an atmospheric scientist or a demographer or other things. We can, use all of these tools to really try to advance our community protections in ways that, again, don't have to wait for perfection to be able to take action, but can let the existing information that we have already move the needle in ways that can protect people's health today.
Thank you both so much. Yeah, I think those are really excellent points from both of you. I think the transparency aspect is so crucial to building that trust and building that engagement. And then, Dr. Pullen, Fedinick, you mentioned something just now about funders and things, and it reminds me that, we need to be engaging with these communities before we even start talking about that funding to make sure that, the things that go into grants are the right questions that's being driven by that too. And so I really appreciate both of those points and the whole conversation we've just now had here. And so with that, I'd really like to just invite the rest of our panelists to return to the stage for a group discussion as our last segment of this forum. And just as a quick reminder, if you'd like to ask any questions of our panelists, we invite you to send us the questions. There's a website, Slido, SLIDO.com, and it's under the hashtag OSTP-HEI. And with that, I will pass it back to Gretchen. Thank you so much.
Great. Thank you so much, Melanie, and thank you all for returning to the stage. Welcome back to all of our panelists. We wanted to take this time for a bigger group discussion because all of you bring unique perspectives to this challenge and this opportunity that we, as researchers, as community members, as decision makers in different ways, and as a nation, all have to leverage research, science, and technological innovations to advance environmental justice. And this is a really important moment in time for that, as we've heard. We have these unprecedented air pollution research advancements, from new and emerging satellite products to low-cost sensors and other ground-based monitoring techniques, to new innovative modeling approaches and community-driven research methods. And all of this can help us better assess air pollution exposure and health inequities at scales that we haven't seen before over time and space. But we can't stop here, as we've heard. We have the opportunity to ensure that these new research advancements are leveraged to inform policy decisions across all levels of government. And at the same time, we have engaged communities and policymakers who are interested in tackling these questions. And so I'm interested in hearing from all of your perspectives on how we can ensure that these connections are made and ultimately result in improved outcomes for communities. And so first, for this segment, I'd also just invite panelists to raise your Zoom hand so we can get a good discussion going. But I want to pitch this first question to the researchers who presented for us in the beginning, Dr. Beamer and Dr. Morello-Frosch, as where do you see the biggest gaps and challenges in operationalizing a lot of this new research, these new innovative approaches for environmental justice policy decisions? You both are doing some of those bigger, more innovative approaches and in thinking about building those bridges. And so I'm curious where you see the sort of bigger challenges or gaps that make this work challenging.
I'm happy to just jump in here and I think so. One of the biggest challenges I think is we have better and better, more and more, and better data, better technologies, as you stated, and I think the key challenge is to get funding for science that is both data and community driven and has that it hits that sweet spot. Because I think there's a lot of conversation about how science can improve well-being for communities, but I think more needs to be done and investments need to be done that acknowledge that community engagement actually makes science itself better. It ensures that it improves what I like to call the rigor, relevance, and reach of the scientific work that we do. It's ensuring that, for example, asking the right questions about some of the challenges of the data that we have, the parts that it's missing. It ensures that the questions that we're asking of that data are relevant for the policy realm and to have that bias towards action, as people have previously said. And then it ensures that the impacts of our science actually, the reach has a policy impact. And you can't do that without community partnerships. Data alone has never really done much to advance policy change. It's those collaborations and integration with advocacy and organizing that ensure that science actually has an impact. I mean, if climate change science is pretty awesome right now, and we can see that data alone doesn't move the needle. It's also that integration and partnerships with communities. I'll stop there. So I think we need to be investing in those partnerships and the development of those partnerships to ensure that and advance the rigor, relevance, and reach of EJ science, and ensure that it's more anticipatory and solutions oriented.
So I couldn't agree more with what you just said and what all of our previous panelists have been saying. I just keep sitting here and nodding my head. So I really am enjoying this afternoon. One of the areas that I feel like we need more support so we can address some of these big gaps is really to start thinking about funding research related to exposure science, to the factors that lead to these inequities and interventions to reduce these exposures. If you think about it, NIH has a vector biology study section, which is really addressing exposures to vector-borne diseases, but we don't really have a funding mechanism where we can do something comparable for chemical exposures. And for many of our contaminants like lead or arsenic or the air pollutants we're talking about today, we already know the documented health hazards. We already know the inequities, but if we don't have a specific health outcome that we're studying because they're associated with so many that take so many years to develop, it really hampers our ability to have innovative research to address these inequities in pollution and exposure. If we're not able to even have mechanisms to apply to do research with communities on a more broad basis than what's currently available. The other areas, I really like the comments about how academics need more training and how policy is done, or how risk assessment leads to some of the guidelines that we use in communities. And so much of this is based upon assumptions and exposure factors, many of which have limited data, and the data that is available is not current and does not usually represent those communities that most of us are here working with and those that are most impacted by environmental exposures. For example, when I was working with the Navajo Nation on the aftermath of the Gold King mine spill, we identified over 40 different activities that were common in the community where they directly contacted the river itself. Yet those weren't included in risk assessments and decisions about reopening the river on their nation by the federal government. There's also the quote that I gave earlier about 90% of our time's being spent indoors, but that's really based on one study conducted in the early 1990s. It may not be representative today, and if we're thinking about air pollution from outdoors and our time indoors, we need to have a better idea across these communities about how do we collect data in communities that are experiencing these environmental injustices so that our policy guidelines and decisions that can be based on models and assumptions that actually reflect their unique exposures.
Dr. Pullen, Fedinick.
Yeah, thanks so much. I think this is really an important discussion. I mean, one of the other things I'd like to prompt us to do is to think about the ways in which we define innovation. You know, when I think about the greatest human innovation in human history, it's probably hand washing, right? You take an oil or fat, and you mix it with lye, and you can prevent all sorts of diseases. And so, you know, another example, I will get rid of the countries, but, you know, country A spends $1 billion to develop a pen that can write upside down, write underwater, you know, write in space, all of these other kinds of things, and country B just uses a pencil. You know, I think that oftentimes what we need is just a pencil. We have solutions that exist, and I think that our funding structures, our in other structures, right, are ways in which the currency in which we exist, particularly in the scientific world, are based on newness and novelty, and, you know, ways in which we can, you know, innovate to move the needle. But I also think that we need to be reflecting on solution sets and answers that we already have, right, and using what we have to make the best decisions that we can when we know there are specific communities that are already impacted by the issues that we're discussing today. So I love data, you know, I dream of data, I think about data all the time, but, you know, ultimately maybe this is a situation in which a pencil will work, and how do we create the policy structures that get us there and think about our science in those ways as well.
Thank you for that. I missed whose hand was first, but let me go to Marianne.
Nicky was first.
Okay.
Oh, go ahead, Mary. Sorry.
Okay. I never want to go before you. I never want to go after you, though, so maybe this is better. So I wanted to pick up on Dr. Beamer's point about training. I think there are two areas for training that are helpful. One is to better understand the key policy questions and legal frameworks. You may have cutting edge science, but if we want to use environmental statutes to safeguard public health and welfare, it is critical to understand the legal and regulatory frameworks. And you know, I think translation of science is not just adding infographics that can be helpful, but it's about tailoring research to meet decision-making frameworks under laws or regulatory processes. So that training is really important. But the other training I think is important is the training related to community-driven research and working with communities, that set of skills and understandings to make it more effective. I think a lot of people really do feel like they're, even if someone else might describe them as helicopter researchers, they think they're doing good. They're going to the community, they want to be helpful, et cetera. So where is that gap? How do we address that gap? And I know some of the people, you know, here are training the pipeline of students in their, you know, their PhDs, their researchers, and there are thousands of researchers now who are working together in associations on community-based science. So all of that's good, but really thinking about what training is needed along those lines. I had the pleasure of often guest teaching in Steve Wing's community science class, and it was and others have picked up that methodology. But it was devoted to training new researchers on community science, and he co-taught it with someone from the community that they often worked with and partnered with and did research with. And it was such an amazing experience to see how community-based science was described and lived in that class. Thanks.
Great, Dr. Sheats.
And I just wanted to emphasize something, and I think Dr. Beamer said it first when she first led us off, and I know all the folks in this panel do it. We're talking about partnerships with communities. Well, we need to make sure we have partnerships and not transactional relationships with communities, right? Partnerships that last beyond, that ideally start before the research project, any particular research project, and last beyond it, or you know, last beyond that particular research project and exist. And I think that's a great way to operationalize. I think you say, Gretchen, you know, you have all the data and everything and the methods, and you have community groups, but how do you bring them together and make progress there? Because then I think that's when you get the real trust And also that's when the scientific community has a better feeling of what is important to the community, right? And then those research questions just bubble up, I think, kind of organically, and you can fill in the gaps in the research.
Thank you for that. And that's actually a really good segue to the next question I had for you all, which was building on Marianne's comment about the perspective of communities, that there's been data, or there's often been enough data, adequate data for action, yet we haven't always seen that action on the policy side. And so as we move into this place where we're getting more and more data, more and more scales, and while at the same time, there's going to be varying levels of certainty in that data. Sometimes, you know, as we look into low-cost sensors, we can get more data points in more places, but there are sometimes trade-offs in accuracy and exactly what the kinds of uses are for that. And so I'm thinking about, as we move into that phase, you know, how do we think about leveraging the data we do have and the level of certainty we do have to get into decisions, so that we aren't stuck in this place of you know, never having what some might consider adequate certainty for bigger policy actions. You know, how can we better leverage what we have to get outcomes? Anna.
Yeah, I think I was going to say this, piggybacking on what Nicky was drawing out in the last question, which is, you know, a lot of our experience in New Jersey with developing this law with EJ activists on the ground, a lot of the most difficult questions were not technical. They were normative questions, right? They were questions that were political questions around, you know, how do you set a threshold by which you determine community A is overburdened and community B isn't? What's the right, you know, level? You know, what are the socio-demographic thresholds? What are the stressors, the appropriate stressors? What are the thresholds for, you know, comparing those stressors? And the answers to a lot of those questions are more are definitely, you know, steeped in moral and ethical questions and political questions. And so in those moments of negotiation and political advocacy and activism, which the organizers on the ground must do, and they must lead, right? Researchers aren't necessarily going to be in the lead and should not be in the lead to make EJ policy. It should be EJ activists doing that. But do EJ activists and organizations have trusted partnerships and relationships with scientists who are willing to testify, to offer guidance, to offer both formal and informal, you know, advice? And there are not enough of those scientists and researchers that communities can turn to in these very touchy political moments when they're trying to organize their you know, their politics, the policy and advocacy, that will be there to publicly and informally accompany communities in that journey. And often that's a long-term investment. That's not just a one-time thing, right? That's something that, you know, you will be needed for in the future. So, and I would love to encourage more and more researchers and scientists not only to think about the partnerships they can build to do research together with communities, but what are your commitments to engaging in those long-term policy and political advocacy efforts, where surely your insights will be useful together with the leadership of EJ communities.
Thank you, Dr. Baptista. So that makes me think about a few other things, and I want to lift up one theme that has come up, which is around the difference between what might be scientifically interesting to do and what might be what communities are interested in knowing and what decision makers need for policy decisions. And many of you have had a lot of experience in thinking about bridging that gap and really asking policy-driven and community-centered questions. And so I was curious to hear from you all on if there's things that you learned or ways that you reframed your research in response to what the needs were from a community perspective, or what policy what was of interest from a policy perspective. You know, what have you sort of learned in doing this research and looking to fill this gap? Dr. Morello-Frosch.
Yeah, I think, you know, one of the things that we've learned is when you have ongoing sustainable relationships with community partners, and by that I mean, like, you're still working together on policy issues even when there's no money there. You're still collaborating during those dry periods, and then you have an opportunity to formulate a project, and you're writing it together, and you're really trying to develop it around specific policy challenges that require some scientific research to answer questions. So I have a non-air quality example, but, you know, in a collaboration that we have with the Community Water Center, which is a water justice group in California, we have a human right to water law that's been in place for a really long time, and it's supposed to protect both people who are on community water systems, but domestic well users. But there's this huge gap of terms of where domestic well communities actually exist. And so that was like one of the formative things that we sought to address from a kind of applied research point of view, is to develop better layers and information and data sources and a method for trying to identify those places to improve the enforcement and the protection of mostly rural communities that were dependent upon domestic wells. And then I think the other challenge that and this is around like how you invest in these partnerships, is if you're really going to allow sort of community-driven research in terms of allowing the flexibility for communities to help define what are their priorities, those can shift quite significantly depending on what's going on in the policy arena. And kind of mainstream funding sources don't necessarily allow for that kind of flexibility. So many of us have had to draw from foundation funding and other sort of non-traditional sources that kind of give us money and allow for that flexibility to be nimble and shift in terms of what our aims are going to be, depending on what things are unfolding and what needs to happen. So I think, you know, there's some structural impediments to that kind of thing that we need to think more about in terms of how we structure funding community partnerships that allow for that nimbleness and changes in the policy and regulatory arenas, and the emergencies that may arise that we don't anticipate when we're writing these grants at the beginning.
Thank you, Dr. Morello-Frosch. I think that nimbleness is a really important point, given how we know the policy landscape tends to shift. Dr. Sheats?
I think another lesson learned, and what Rachel was saying kind of prompted me. You know, for cumulative impacts work that I have done since 2007, it was never funded. Is that right, Anna? Am I trying? It was.
You're correct. Unfunded mandates are our specialty.
And at times we tried to get it funded. And at times we were specifically told by funders, we are not funding cumulative impacts. And we did it anyway. And I think one of the things we learned was patience. I mean, something you start years ago comes back, right? Comes back later and gives you some opportunity in some way to still work on it, and because of the ongoing relationship, you know, it may still be relevant. So it's the investment in the relationship can you know, may yield benefits much later if you hang in there. And I think it helps to keep you going. How many times do you come to a point where you're like, okay, I can't do one more thing. You know, I need a vacation. I'm done. And, you know, but in the long haul of things, it may come back to benefit you. Just kind of keep at it.
Yeah, that's a really, really good point. Dr. Beamer?
Thanks. I'm really loving all this discussion still. And I really think, you know, that point that was made earlier about training that next generation in community engaged research, a lot of that has to talk to them about, you know, how to be humble, which is not something we're taught a lot in science, and to know that the community's perspectives actually override our scientific expertise. And, you know, in my role as a scientist from a region of the country that's often not even represented at the national discussion, or maybe representing several states, the discussions that I have in the community firsthand are so important to be able to bring back, to bring their voices and those issues that they face. And I want our next generation to recognize that too, like when you finally get to have your seat at the table, like we're all here today, or serving on national committees for EPA or the national academies or ATSDR. And even importantly, when we're sitting on those grant review panels, we need to be thinking about how we can bring those voices to make sure that the research we're funding will lead to action that the communities need, and not necessarily continue perpetuating some of the things that we're talking about. And just to kind of echo some of what Dr. Morello-Frosch said, you know, I think in that framework I presented in my talk, you know, we were really talking about how important it is for those community research partners to have the decision-making authority on those studies. That includes making them co-PIs, sharing the funding, making decisions jointly, even if that takes time and slows down the research. And I still hear these discussions when I'm serving on study section if community members can be co-PIs, and I'm so glad to see that that's changing. And in the end, you know, our findings will actually be more authentic and better represent those needs if we continue to incorporate that. So I'd really love to see, like we're all saying, we need more funding opportunities for building those partnerships, maintaining the sustainability of those ongoing community partnerships that we've been doing on our own for so long. But it's a great discussion that we're having here today.
Great. Thank you so much, Dr. Beamer. Ms. Engelman-Lado.
Now, this, I think, is complementary to Dr. Beamer's point. I wanted to push back on the idea that, although it may occur in any given instance, that there's a tension between what might be scientifically interesting in research versus what communities might need. It strikes me from research I've done and lawyering that it's an honor to be listening to and learning from and trying to figure out strategies, questions, research that is responsive to what communities need. And I'm not trying to suggest it's all about the researcher and we should be extractive, but rather that the questions that come from reality and the lived experience are some of the most challenging, most interesting questions. And we bring, you know, knowledge, theoretical constructs, but it challenges us in really intellectually interesting ways to figure out how to be responsive. So I know for any given person, it may be true that you've got some great idea and there might be a tension, but I think in general, flipping that and recognizing how challenging and fulfilling and scientifically interesting working with communities can be, you know, is the piece I wanted to put forward.
Yeah, I really appreciate that. And I think that's a good point. And so that also ties into one of the questions that we're getting on the Slido app, which is about exactly how you involve communities in research. You know, where are what are the stages where that makes sense? Where is it appropriate to involve them? And Dr. Beamer, I think, touched on this a little bit, but I wanted to provide an opportunity for anyone to say a little more on that if they would like. Dr. Morello-Frosch.
I think, you know, how you involve communities in research is a continuum. It's not a yes or no proposition, because community partners vary in how they want to engage in the research enterprise. And, so that could mean whether they want to simply play an advisory role and, be able to have input along the way to, all the way on the other side of the community partnership continuum, where your community collaborators are partners, you're writing the grant together, you're managing the grant together, or they're managing the grant and subcontracting to scientists. So it really depends, I think, on the needs, interests, expectations, and capacities of community partners in terms of how you engage them. To me, the most fruitful ones are the ones where you have the time and the ability to do relationship building and planning together. And those conversations and that work can take a while. And so, I think, as Nicky said, patience is a big issue, because you're developing trust and you're trying to be forthcoming about your needs and expectations and goals for the work, and also an honest conversation about the potential risks of collaborating on research together, things like mission creep that can occur with community partners if they're really engaged in a very resource and labor intensive project that's scientifically based. The fact that data can work in mysterious ways and may or may not validate community wisdom on a particular topic, and how we want to anticipate the possibility of those kinds of outcomes. So again, I think it needs to be thought of these kinds of things as a continuum.
Yeah, I think that's a really important point. And I think also responsive to this question is Dr. Pullen Fedinick's earlier point on what communities already know, and coming in and or maybe it was Dr. Beamer, I can't remember which of you said this, about coming in with a humbleness. We know science, Western science is only one way of knowing, and knowing that that's not everything. So Dr. Pullen Fedinick.
Yeah, I just wanted to underline, multiple times in rainbow colors, what Dr. Morello-Frosch just said too on the capacity piece, right? So I think that, oftentimes, community organizations can be very small, volunteer-based, organizations that, if you're coming in and saying, how can I help? How can I help? How can I help? That could be worse than if you were actually solving the problem. And I also think coming in with, not only your scientific lens, but your human lens, like what are the things that these community groups actually need from you, right? Is it printing things out and distributing them? Is it showing up? I mean, Dr. Baptista talked about this at, to testify, for something. And so I think that really finding ways to engage that, don't take away from the work that community-based organizations are already doing, and finding ways to be of service, attending meetings in which folks are attending them, really trying to understand those needs, and the capacity constraints, I think, are really critical in this too.
Great, thank you for that. There's been a couple different questions on Slido that talk about some of the different structural barriers around research funding and what's valued in the academic community, and what are the different ways we can think about navigating a lot of this space in doing this work. And so we've talked about some of those barriers, but I wanted to hold space here in case anyone had other thoughts about what those challenges are, how we address them. What are the ways that we can navigate this in a world that doesn't necessarily have the same incentives that we might want them to. Just a quick, easy, solvable question for the end. Dr. Pullen Fedinick.
Yeah, I was going to say, if anyone on Slido has a solution to this, feel free to populate it there so we can all take that information back and work on it. I think this is so difficult. the systems are entrenched in ways that aren't actually set up to protect people, especially those that don't historically have those protections. And so again, I think that when we think about science informing policy, some of that is also becoming engaged and aware of the ways in which, funding decisions are made, for example, within federal agencies, which are huge bureaucracies and hard to shift, or, identifying other mechanisms of funding that are outside of the traditional norms to try to, provide, support for you to do the work, maybe volunteering to do the work in ways. But, I think that these are really difficult questions to ask and answer. And they're always asked in these types of fora. But if anyone has brilliant solutions, it would be great to hear more about it too.
Great. Dr. Sheats.
Well, let me make this comment to you, Gretchen. I think you're helping to solve this now. I mean, for me, I was in a very non-traditional university for a long time. So, I mean, you have real scientists with you and a brilliant civil rights lawyer. I work on policy. So I thank you for inviting me to the panel. And I think the fact that you do and say, well, he has something of value to say, even though he's not a traditional, scientist, I hope that does help change, and maybe I'm being naive here. I hope that does help change the way traditional universities look at things. And when they see that, well, Dr. Goldman from, Office of Science and Policy values what he has to say, maybe they will start doing it also. And of course, you're valuing what communities have to say, also. So maybe that will help move the more traditional universities a little bit and help them value also, scientists, academics, people that do the work directly with communities and may not fit the kind of traditional, university mode. Their work may be a little bit different.
Yeah, thank you for that. Dr. Beamer.
Yeah, I love what both of you just said. And I guess for me, I forgot how to lower my hand. One of the areas where I've had the pleasure to serve has been on, like I said earlier, on Navajo Nation, but that involved going before the Navajo Nation IRB board, where you have to defend yourself every single time you give a talk, whether it's a talk like this or a talk in the community, about how your research is benefiting the local community and the Navajo Nation. And I wish we had so many more similar boards like that across the nation and the communities that we work in. And it was, it was an honor to get to sit there and witness that. And, you have to be committed to that community if you're going to go drive 6 hours each way to present 26 times over a 2-year project. So these are the kinds of things that, show that commitment that I wish we had more requirements as we're working with these EJ communities across the country. The other area is, I think, we keep saying the communities already know that, things like arsenic and lead are bad for them. We already know that it's associated with health outcomes in almost every part of their body, but yet, we keep funding more research on this other mechanism that, arsenic does. And yet we don't have, like I said before, a lot of research opportunities for how do we fix that problem? How do we address things like private well owners and solutions and communities that can help people understand, is it, their water, is it the air, and things like that. And then I guess as in our role as scientists, when we're sitting on those review panels and even the NIH ones require you to assess the overall impact as your final score, how is this research going to actually change how we do things moving forward? And we need to think about that as we're setting those scores. Is it enough to just document disparities, or are they actually coming up with solutions in those grants that they're proposing? And how do we push that, as we continue to change that paradigm? And as more of us with that perspective sit on those study sections, how can we continue in that area?
Yeah, thank you for that, Dr. Beamer. Last on this question, Dr. Morello-Frosch.
Yeah, just to add on to the great comments so far on this important question. I think, what Dr. Sheats said earlier is just how do we change the incentive structure and the expectations of the institutions that support science that in ways that are beneficial for advancing environmental justice and research that leads to policy change. And I feel like there are signs of some cracks in the wall in evolution, moving towards there. It's slower than we'd like. So, for example, the California legislature just allocated $100 million to the University of California to fund what they call action-oriented research related to climate resilience. And one of the criteria are authentic relationships with communities in these research projects. And they make it very clear that it's not about publications that we're going to be evaluating. This has to lead to very concrete changes within the next 2 years. So if you're writing that project and you're applying, you have to really make the case for how this project will lead to change of policy relevance in terms of California's climate resiliency goals. So I think that's one model out there where there's financial incentives being put in place to help move us in this direction. And then I think on the other side of things, like hopefully this will incentivize traditional funding agencies to better and adequately fund the action-oriented pieces of large scientific enterprises. So, you know, many of us, if we want to apply to NIH to create the center of this, that, and the other thing, the science projects are very highly funded. And then you have a community engagement core that gets about 1/5 of what's allocated to the scientific thing. And it's very labor-intensive work. And I think it needs to be acknowledged that needs to be more robustly funded if it's really going to be sustainable over the long term and put community partners on an equal footing with scientists in these long-term enterprises and research centers.
Thank you, Dr. Morello-Frosch. Those are good progress points or places for us to look for how to improve on that issue. As sort of a final lightning round question, I wanted to see if you all had one thing you would recommend someone read who is thinking about this issue and wants to learn more or understand more about what to do. So it could be something you wrote, could be something that was influential for you. Just wanted to hold space for anything that you might recommend people read to learn more.
It's a great question. I wish I had an answer for you.
And to be fair, I didn't tell you in advance I was going to ask this, so this is a live question. Marianne. Oh, you're muted.
I'm going to be rebellious again and push back against the question and give you two in very different directions. One is the article that Steve Wing wrote on an environmental justice. I don't remember what it was. I can look it up, but environmental justice research paradigm, and it contrasts. When other people are talking, I can share it with you. But it contrasts. I think it was environmental health perspectives. It contrasts a traditional research paradigm with an environmental justice research paradigm. And it's just, there's a lot of work since then, Jacoby Wilson and others, but it's sort of a seminal article on the theory. And I think Dr. Pullen Fedinick sort of was drawing on it because and others like it, because it talked about where have the greatest changes in public. It didn't have the pencil example, but in public health happened, and people often think it's penicillin or something else, but he turns that around, and it's a really good article and very interesting. But coupled with that, I want to go back to, I think it was Dr. Morello-Frosch's PowerPoint and the book, Richard Rothstein's The Color of Law, which I think is bedrock reading for understanding our landscape and the footprint of the history of segregation and discrimination on land use today, and why we have the unequal patterns of exposure to health hazards, at least as sort of layers upon layers that we then are hoping to change, but also are being exacerbated by decisions we make because unlike in other areas of the economy, let's just say education, where there were court rulings that said we had to root out segregation and the effects of segregation, root and branch. We never had those kinds of rulings in the environmental sector. We had formal levels of segregation and redlining, and then we never uprooted the zoning, et cetera, that was laid down during those times. So understanding that backdrop, there are others, Trustee Taylor and others who have written on it, but Richard Rothstein's The Color of Law is really an excellent book to give that bedrock understanding. Those are two.
Great, thank you for that. Dr. Pullen Fedinick.
Yeah, I love The Color of Law. I also would recommend that too. I would also suggest folks read a NEJAC report. Go back and read the, we call the Red Book for the National Academies of Sciences on how risk assessment actually happens in the federal government. Look at a WEJAC report, look at some websites of groups that are near you geographically to see what their needs are. So really try to enmesh yourself in the process, and then the questions that the folks around you are asking.
Thank you for that. Dr. Morello-Frosch.
Yeah, I want to make a plug for a paper that Dr. Beamer is the co-author on that she referenced in her presentation, which is the an applied environmental justice framework for exposure science.
Muted yourself.
I'm totally muted. Sorry. I was trying to chat something, the reference, but I don't know if I can. So fantastic paper. The other books by related to sort of the how-tos and the mechanics of community-based participatory research by Meredith Minkler, Nina Wallerstein, and others are great references. Many scientists in environmental health have contributed to those volumes and can give people a real kind of how to do this kind of work that's, I think, really useful. And another fantastic book that came out a while ago, but I think is still very relevant today, is Jason Corburn's Street Science is an excellent book.
Great, thank you for that. Dr. Beamer.
Well, thank you, Dr. Morello-Frosch, for that. And I agree that the work by Wallerstein too has really shaped how I do my work. I was trained as an engineer, so a lot of these were not things that were part of my formal training. But the article that really, I've been teaching it for a long time in my environmental justice course, but it really came home to me in fall 2020 when I was teaching that class again during, some of the more intense parts of the pandemic, is Chandra Ford's article on critical race theory, race equity, and public health, and towards anti-racism praxis. And I even shared it with some colleagues the other day that were frustrated again to have their grant rejected because they don't have a comparison population or all these things that we hear all the time. And that article really highlights in ways that are way more eloquent than I can say, when we're working with marginalized communities, why we want to focus on the marginalized community. We don't need to compare them to the majority community. We're focused on addressing public health in those communities.
Thank you for that. Dr. Sheats.
Yeah, Rachel beat me to it. Dr. Morello-Frosch beat me to it. I can really, and I'm not just saying this to kiss up. The work of the people on your panel have really inspired me. I mean, I see Anna close up all the time, how she works, and worked a lot with Rachel and Marianne, and starting to do that with Kristi too. And even I listened to Dr. Beamer's presentation and said, "Oh, she did what? Oh, that's pretty cool." So I think if you pick up anything almost from the work with people on the panel, you will see how they work, and I think get a good idea of what we're talking about. And I hesitate to call out one article because I've been inspired by many of them.
Thank you so much, Dr. Sheats. Dr. Baptista.
Yeah, Nicky. So what I was thinking too, I mean, I'll put a shameless plug in. When we were doing a lot of EJ policy work in New Jersey, we looked at all the amazing articles from a lot of people on this panel and a lot of published work. And we actually compiled at my center, a lit review on EJ definitions, on cumulative impacts methodologies, state laws and policies, really just as a practical guide that other folks could use. And I would also go to the websites and reference the environmental justice organizations around the country that have amazing and very sophisticated and advanced research and policy documents that they are proposing and putting forth. The New Jersey EJ Alliance has their own cumulative impacts policy, mandatory emissions reduction policy, much of it really the brainchild of Dr. Sheats and a lot of his hard work and research in that. But there are EJ organizations around the country, in every part of the country, that are advancing really innovative work, and we should learn from them and check out their websites and their research that they're advancing in the policy work that they're looking at.
Great. Well, thank you so much for that. And with that, we will close out this webinar. But thank you all so much for all of this rich discussion. It's clear that there's a great opportunity for researchers to contribute on this issue, asking policy relevant questions, working in partnership with communities, and directly informing policy decisions at all levels of government. So thank you to the Health Effects Institute for co-hosting this event. Thank you to all of you panelists for joining us today, and we'd like to keep the conversation going as OSTP and HEI move forward in working on this important topic. We'd invite you to provide any feedback or ideas you have related to this event by emailing us. We have an email set up at airpollution@ostp.eop.gov. And stay tuned for a summary and some follow-on actions from this event, as well as future OSTP Year of Evidence for Action forums. Thank you all for joining us today.